Hi, good evening, everyone, and welcome to another episode of Fasting and Beyond. I changed the name if you didn't catch on. Um, Tonight, we are going to be joined by Dr. Hussein, so I'm just waiting for her to join. And then as soon as she joins, we'll get started. But just for a reminder, for those who may not have tuned in before, um, I just want to make sure that everyone is aware. Oh, hold on. Dr. Hussein just joins. Hold on. Let me connect with her and then I'll go over the disclaimer. We're connecting. And hi, how are you
Hi, how are
doing?
you?
Good, good. Thanks for joining tonight. Glad to
No
have you.
problem.
I was just going to give a quick little medical disclaimer and then read your bio, and then we can get started.
Sounds good.
All right. So, everyone, like I was saying earlier, I'm joined by Dr. Hussein tonight, and we're going to talk about teens, obesity, body image, and just practical ways that if you have a teen or deal with teens, that you could address this with them without making them feel self conscious. Because this isn't about looks, it's about health. So, just for a brief medical disclaimer, just because we're physicians, neither of us are your physicians, nor are we the physician of your child. So this is going to be informational purposes only. If you see something discussed here that you think may be of benefit to either you, your family, a loved one, someone you know, I would suggest discussing it with your care provider and seeing how it should be tailored to your individual needs. So that's what I would like to say. But I'm going to go ahead and introduce Dr. Hussein, who is a board certified pediatrician who's truly passionate about her job. Not only is she a fellow of the American Academy of Pediatrics, but she also serves as a lactation consultant. She completed additional coursework with the focus of in food literacy, nutrition, and health, and completed her pediatric residency at Georgetown University Hospitals in Washington, D.C. In addition to running her direct primary care practice, Dr. Hussein also began a healthy weight clinic for school-age children and teenagers who struggle with obesity. So she's definitely very well qualified to speak with us tonight and share her knowledge. So with that, welcome and thank you so much
Thank
for
you.
taking time out of your schedule.
No
Um,
problem.
Yay. So why don't we begin with you just telling us a little bit about yourself? I read a brief bio on you, but
Sure.
maybe tell us about your focus and also if people want to follow you online or keep up with your work,
Yeah.
where they could do that at.
Sure. So, just like you very nicely read out, it's always so hard for us, I think, in medicine to hear about ourselves. But I am a board certified pediatrician. So that means that in the medical field, I'm the expert when it comes to everybody from an infant to the end of their teenage years at the onset of adulthood. And I'm a general pediatrician for anybody out there who's non-medical, so that means I'm not a GI doctor, I'm not an endocrinologist, I'm not a developmental pediatrician, but I'm a little bit of all of those things. And as a general pediatrician, one of the strongest, biggest suits in our toolbox is a child's health, their nutrition, and their growth. All parents always come in and ask us to see the growth charts. And we take that with a grain of salt because just like Dr. Clark had mentioned, every child's a little different and we know how to interpret those growth charts as they go along. But childhood nutrition and health is one of the biggest things I'm passionate about. And I chose to do extra work in it because it's not something that they really pull you aside and talk to you about in medical school.
Right.
And even in residency, you know, a lot of male pediatricians aren't very comfortable with breastfeeding knowledge. You know, people who are not parents might not be as comfortable giving tips on how to feed children. So I specifically sought this out because it was something that I realized was a knowledge gap and that interested me a lot. And my healthy weight clinic, I always tell people I think the big buzzword nowadays is food is medicine.
Mm-hmm.
But food food can actually be poison too. It can actually harm us.
That's a good point.
And
Yeah.
I think that perspective kind of comes out of sort of alternative medicine, which we now see as integrative medicine, and where you kind of marry holistic ideas with traditional medicine. And I actually think that's how a lot of pediatricians already practice. You know, we take do no harm to another level, where we really try not to test, we try not to do labs. But that's kind of where this Healthy Weight Clinic came from. I wanted to teach families how to pursue the best health outcomes, not just for themselves and for their children, but to teach these practices into everyday life and make things very simple, not complicated. I'm a mom too, and we can't be preparing 3 different meals for everybody in the house.
Right.
So that's what we kind of do in the Healthy Weight Clinic. We not just, you know, treat the child, we treat the whole family, and teach them practices that can make it very easy for them as they go along. Everybody has busy lives, so.
Right. No, that's a great background. And I think that leads us into some other questions I had. So sometimes what we'll see, and you can definitely give your perspective on that, but, you know, I could encounter a adult who has a child or a teen who's a bit overweight or is, you know, truly actually overweight and has health conditions associated with it. And I think sometimes the people are not comfortable with addressing weight with children, or they don't know how to do it in a proper manner. But for people who just may be hesitant about discussing weight at all with their teen, what are some of the potential health complications associated among teenagers who are obese, looking at it, you know, from just a purely health perspective?
Right. So excluding sort of the adult diseases that, you know, I'm sure you're familiar with, you know, the diabetes, the cardiovascular complications, we are starting to see some of those diseases trickle into pediatrics in the teenage population because the obesity goes so long until it's addressed. And you're right. You're absolutely right. A lot of people do slide it under the rug. Whether you are crunched for time and you don't have the time to explain, you don't have the interest in it, or you just think that nobody's going to listen to you. A lot of doctors, they carry along the misconceptions that families seem to think, which is they'll grow into their weight.
Mm-hmm.
You know, that's one of the misconceptions I hear. I can tell you more a little bit about some of those, but I mean, these misconceptions, unfortunately, you're actually doing a disservice because it just gets harder for the child as you go along. And so one of the things I do in my Healthy Weight Clinic is you know, I don't just see them once. I see them at least for 10 visits, and each visit has a different tactics. So no, we do motivational interviewing, but we also assess their healthy habits. We see what their stage of change is. So are they actually willing to do that? Take that leap, move forward. And we do run some basic lab work at that time. So some of the things that I'm seeing now are elevated A1Cs. So not essentially diabetic yet, but pre-diabetic. We're also seeing elevated lipid levels. And in my pre-teenage, so I'm saying around like 11, 10-year-old school-age children, we are seeing some pre-hypertension. And the reason why this is important to address now is, as my adult doctors can attest to, is that we can take care of this before they need medication. You don't want to put them on medications this early on. If you can help it. Because these things are all, it's so great when you can fix something just by changing a lifestyle habit, and then you don't even have to go into the medication realm. So those are some of the things that we're actually already seeing. And that's just the purely medical side of it. The non-medical side of it is a little bit even harder because we're seeing an impact on their self-esteem and their self-confidence. And anybody who's ever been a kid knows that when your self-confidence is low, it's really hard to take a hit from. And I'm not just talking about bullying, but, you know, kids who are, you know, being called names. When your confidence is low, your academic performance is shown to be lower as well in school. They also feel that, you know, the weight is their fault, you know, and that's not necessarily true. And then, you know, on top of that, we're seeing that these sort of stigmas, they translate into social stigmas as they get older. So someone who's maybe one of us who've been an overweight child, we remember being picked last in dodgeball, and that doesn't give a good memory. And those memories are the ones that we carry forward into adulthood. And we are seeing that children who are overweight become overweight adults who struggle with the same problems. So they are less likely to achieve admission into prestigious universities. They're less likely to have higher salaries. There are crazy statistics out there that we're seeing. And even less likely to have a happy dating life or find a life partner. And what you see that is translating into teenage depression, and that feeling of feeling isolated and feeling like an outcast. And oftentimes that's tied in with emotional eating. So when you feel down about yourself, these children, or teenagers, they then turn to food because food is their source of comfort. And then it's a downward spiral. So you see this medical aspect of it, but you see this even more complex aspect of it. And it's really hard to tap into that because children may be not likely to talk about it if it's not addressed or asked directly. And then, it shapes you. It kind of changes what your self-confidence is and how you feel about yourself at a very vulnerable time in your life.
Yeah, no, all of those are important things to realize. And so I think sometimes, as a parent or guardian or what have you, you may feel that you don't want to address it because of the fear that you may cause some of these issues. But the reality of it is that these issues either are there or may be there or could be developing. And so really addressing the weight from a standpoint that this is about your overall health is something that, we need to do. And if you're not comfortable doing it yourself as a parent or guardian or what have you, seeking out a pediatrician or someone who's familiar with adolescent medicine to help you address these concerns. You touched on it a little bit, but how? My screen timed out. Sorry about that. I was going to say, so you addressed this a little bit or went into it about how body weight can affect self-esteem. Is there anything we need to be careful with when addressing weight with our children, though, or with teens? Like what are good ways that we could approach that without making our child feel down? Because I think just telling a child you're big, okay, that's going to be one of the worst ways to do it. But you'd be surprised how many people or family members, cousins, aunts, uncles, or whatever will, make nicknames and call people like little fatty or little, big boned or whatever. So obviously,
and it's funny you bring that up because culture and ethnicity does play into this a lot. So, it's seen across cultures across the board that, different cultures have different body types that they respect and consider the ideal body type. But despite being accepted by their own, ethnicity, children who are overweight still do feel down. And so that's really interesting. So that does sort of correlate with when you are overweight, how does that translate into your self-esteem and happiness? So even being accepted as being a full-figured individual may be okay in their ethnic group. And that is true that their self-esteem is still affected. So I'm glad you asked that because one thing that the AAP recommends and the Obesity Society, when they came out with guidelines on how to, approach child obesity in children, was how we address them. So we don't say, and you might see me sometimes correct myself too, is we don't say obese children. We say children who are obese. Or obese teenagers, because you don't want to define them that way. You want to come at it in a more empathetic manner. And that's how we sort of approach the motivational interviewing as well. So I try and catch myself say it, and then I try and correct healthcare providers as well, that we try to actually change the way we say things. So you don't want the adjective to describe the child, because that's not who they are at the end of the day. That's just one of the problems we face. Just like a child with oppositional defiant disorder isn't an aggressive child. It's a child who is dealing with aggressive behaviors.
Got it.
So that's one thing that I always try and recommend to my parents is just remember when you're saying it, they're not just, a fat kid. They're a child who is battling this or dealing with this issue. The other thing is, just like I mentioned, motivational interviewing. And so we try to focus on the positives rather than negatives. Like, oh, look, you filled up your plate with, fries again. Well, maybe alongside the fries, they actually decide, or maybe instead of the fries, one day they decide to do the baked potato. Don't tell them you didn't eat the vegetable. Compliment them on the fact that they chose a healthier alternative to the typical carb they got. And when you try and focus on the positives, the teenager or the child will not be as, sort of downtrodden and feeling like they're not doing anything right. So that's one thing I think that healthcare professionals and parents can do when they catch themselves. Another thing I see sometimes is children feeling like they're blamed for the problem. Or parents do it vice versa. Like, my child and I deserve the blame for this weight problem. And, there's a lot of things out there. It could be genetics. It could be the diet, meaning, what is the overall diet made of? What are all the things they're eating? It could be the portion sizes. So, you can eat a salad every day, but if you're putting, a quarter to a half cup of dressing on, then
right.
What good does that do? So it could be the portion sizes, or just nowadays, I think the biggest problem we're seeing is decreased movement. Like kids are just not playing and running around the way they used to.
Yes.
And I think that, when I tell parents that it's a variety of reasons and there's no quick fix, then that sometimes takes a little bit of time for them to understand. So, I think they think that this is the problem, it must be fixed immediately, but we try to come at it in a different way, in a healthier approach. Anybody who's ever lost weight knows that if you do it by a fast, get quick fix sort of scheme, oftentimes the weight comes back very fast. And it's also not recommended for a growing child to restrict one food group entirely or only eat one food group, like only juices or only smoothies.
Right.
I'm not an advocate of that by any means, especially in a growing child. Adults, make decisions as they may, but children at this time need as many vitamins and nutrients as you can get them, as balanced of a diet as you can. So I always recommend for my teenagers not to do that. And oftentimes, if they have, a binge eating disorder, it's not a safe way to go about losing weight in general, because it can set them into a relapse. The other things I often hear is, the same thing about, will they grow into the weight? Well, is that a good way, they'll just get over it. I'm sure they'll get over it when they get older. And just like I kind of hit on earlier, it doesn't really work that way. And one of the things we actually see, and this is going down to the very, very littles, is the parents of NICU babies. So in the NICU, they always emphasize, they gotta grow, they gotta grow, they gotta grow. And when they grow, their lungs get better. When they grow, their immune system gets better. When they grow, you can finally take them home.
Right.
And then when those parents get home, they think grow, and keep getting them calorie dense foods. And at some point, the child's growth velocity stops, isn't as steep, and it slows down a little bit. And then you see that these kids, their growth curve, they sort of go very, very high off the charts. And it's very hard for parents to hear that, I have to cut back on calories, I have to decrease it, and they don't know how to go about doing that. So having the conversation earlier on with your child rather than later, where they feel that their food's being restricted rather than just having a healthy overall diet, is better. So that's one thing I try to let parents know as well, that that's one way that you should talk to your child earlier rather than later. But those are some of the typical things I usually go over with them.
Yeah, no, that makes complete sense. And I think, especially how you talk about the motivational interviewing or just motivational feedback, I think making sure to praise your child when they do make a good food choice, and just kind of flip that thinking in terms of just the constant criticism. surrounded with what they eat or, what they're doing. And some of the other things that you mentioned in terms of movement, it could be a whole topic itself, but just, screen time and things of that nature. And, people will come home and everyone has an iPhone now, and then they have a Xbox or whatever. And then there's Netflix, and there's so many opportunities for children and teens to sit now, that while, we're not saying that they need to go and run 10 miles a day or anything like that.
No, yeah.
To like set aside some more limits, on the screen time, and actually encourage them to join group activities or extracurricular activities that are available to them is also a good starting point. In addition to
and I completely agree with that. And I think that there is, we often see sort of like two ends of the spectrum, like parents who overschedule their children with tons of activities. Sure. And then when the kiddo wants to get home, they're like zonked out, tired, or they have homework to do, and then their sleep is affected. And sleep's another issue that is correlated with obesity as well. But then I kind of come at it a different way, that I tell parents, like, okay, don't overschedule them so much then that they can't do the activities they want. So maybe that means going down to one sport instead of two sports, or maybe doing the one sport that the child actually likes and giving up piano lessons and dance and, debate club, if that gives them a little bit more free time to do the sport they love, eat dinner with the family at the table, family needs are so important, and then get the sleep they want. And then you'll actually see that, the stress levels, the anxiety levels go down. They'll function better. And oftentimes then you'll see the sort of healthy habits start to pick up on them on their own.
Right. No. And I think so, definitely having like a multi approach. In terms of anyone who may be listening, who has a teen or interacts with teens, just in terms of things they could discuss with either their provider or whatnot, what are some practical ways that you've kind of touched on it, some of it, but what are some additional practical lifestyle changes that they could implement just for the family as a whole? Because what I also like to remind people, it's like, we'll see adults, and adults are like, okay, I'm going to get fit. And I'm like, oh, okay. I mean, that's wonderful. We all need to get fit. But it's like, are you learning healthy things along your health journey that you can apply to your entire family, to the household?
Right. I mean, and I think anybody who's done this before knows that, like, if you go out there and you say, I'm going to get fit, and you're going to try to run a 5K and you've never even like walked really regularly, you're going to feel discouraged and give up. So small changes that you can implement and keep up. So one thing I always try and plug into the family is, you cannot just make the changes just for that child who's dealing with it. The whole family has to be involved. You can't expect your child to sit there and eat, broccoli, salad, roasted vegetables, and everybody else is enjoying pizza. Like, that's just cruel. That's just cruel. But a couple of things that I sort of change, I ask parents to change. So believe it or not, we do view food as a reward a lot. And that tendency often starts in childhood. Think of potty training. You get an M&M. Oh, you aced your test. You get a banana split. Well, everything is in moderation. So, I mean, I know you're not going to give a bag of M&Ms, but if they're acing their test twice a week, then maybe we need to think of another reward system and not food per se.
Right.
And on that note, that doesn't mean you have to cut out everything completely, because I know no parent wants to deprive their child, but we have to start then introducing healthier options. So maybe, angel food cake. Maybe you're doing strawberries and whipped cream, or maybe you're doing, banana with some Greek yogurt as a dessert, so that if they have that sweet tooth, you can satisfy it. But you don't have them necessarily hooked on that sugar. And that's another thing. Like I said, I don't necessarily believe in food restriction, but I do think that, the more sugar you eat, the more you crave it. So keep it as a one-time occasional dessert. And don't just say, oh, well, they didn't eat this, so let's let them have cookies if they want. So we're the parent, and I often talk to parents this way too, that their job is to put the food on the table. It's
Right.
your child's job to eat the food.
Mm-hmm.
You know, I grew up with Pakistani parents, and what was put at the table, we ate the same way they did. And if you didn't
Yeah.
eat, you didn't really eat, you know?
Right. It's
And
like, okay, well,
yeah, you know, and that my parents, you have to realize that as parents, we're role models. So, you know, be persistent. Don't fuss. Don't get discouraged don't make comments if they don't eat it. We just gotta keep trying. And honestly, you'll be surprised that the good news is over time, most children do develop healthy habits.
Mm-hmm.
You know, just me, myself. I used to not really like vegetables. And I have to say, I think it was my mom steamed them. But as I got older and I got, you know, introduced to roasted vegetables, I just love them, you know, and that's one of my favorite ways to eat them. And so you'll be surprised. Get your children in the kitchen. That's another tip I always say. So get your kids in the kitchen at any age that you can. Take them to the grocery store with you too. And this can be at any age. If they're teenagers, definitely get them in the kitchen because they can actually help you cook at that time too.
Right.
But you should get them invested in the meal. And, you know, it doesn't have to be a farmer's market if the produce is very expensive there for you. It can be, it doesn't have to be organic. It doesn't have to be the highest quality anything. It can even be frozen produce. But get your kids involved in the process. And you'd be surprised. Younger children actually sometimes prefer raw vegetables over cooked. So you'd be surprised they're more likely to eat maybe your crunchy red bell peppers. Get your teens invested in cooking though with you, and they're more likely to eat the meal. So those are a couple of tips I try to throw towards families. Stop using the food as a reward system. And then just like you said, I think investing in your family meal. So structured eating is something that is sort of becoming not as important as it used to be 30 to 40 years ago. And that really is the core purpose of like sort of family meal times. So that means eating without any distractions. I mean, no TV, cell phones down. And this is where we talk about our day. This is where we talk about, you know, what are you eating? Oh, you know, this is a good time to talk to your kids about portion control. This is a good time to talk to your kids about, oh, you didn't like the broccoli? That's okay. Next time we'll try it again. What's the other way you'd like to try it? Oh, you'd like to try it with cheese? Okay. That's a great way to that's a good conversation to have. On that note, structured family meal times is just in general very good for families who are dealing with children who have obesity issues, because if dinner's at 6 one night and then dinner's at 8 one night and then the kid doesn't know what time to expect dinner and they're gonna reach for a snack at 5:30 because they don't know what time dinner is. So if you want to keep snacks to a minimum, try to keep structured family times. And this is actually a good time to do this because you see that as, you know, adolescents or as adolescents approach teenagehood, you see that family mealtime sort of drop off the map. And that's when obesity actually gets at high risk of increasing. So it's very interesting that we see that sort of eating together as a family really helps to improve intuitive eating as well.
That makes sense.
Yeah, it's really interesting. I would have never thought that. But I think that those are really good concepts just to have in general, whether you are dealing with children who are battling obesity or not. I think it's a really good idea to set media-free zones in your house. I mean, just like you hit on before, screen time is like, I almost feel like it's like what we view cigarettes as today. You know, this is going to lead to a whole generational gap in so many ways. So try to keep your family dinner table free of media. And then slowly expand that maybe to the kitchen, and then slowly expand that, you know, to the children's bedroom. You know, keep no TV in the bedroom so that they can actually focus and get sleep when they want. So,
yes, no, all of those are great points. And I think sometimes as parents or guardians, we think that, you know, oh, our child's going to miss out because they're the only ones who don't have a TV in their room, or they're the only ones who don't have the Xbox, and you got to let them be a kid. But you're actually helping them, you know, for them not to necessarily have that, because what I always tell people, it's kind of the same thing, like when you said decrease the mindset that the food is a reward. So you get a cupcake because you did well, or you get the thing is, like, you don't have to be crazy about it, but at the same time, you're not depriving your child of an experience, because sugar and treats will find them. I mean, they're going to go out into the world, and you don't also want to be at the birthday party and you're so anal that now you're like, well, now my kid can't have the brownie. Like, have the brownie at the birthday party, because during the week we don't have sweets all the time.
No,
so, you teach them about moderation. It's the same thing when we see adults who are, dieting. It's like you can get so restrictive that you're just like, oh my gosh, I can't have anything, rather than pacing yourself. And then when it is someone's birthday or whatever, you're not worried about it.
Right. And I think that's the key to not just, living your life anxiety free, but almost to parenting, right? We can get on a soapbox about tons of things, but you got to pick and choose what's important to you. So is screen time important to you? Is eliminating all sugar completely important to you? Is organic important to you? Is, having your child listening to Baby Einstein important to you? You have to pick and choose what's important and then pursue those things. But these are habits that are going to follow them into adulthood. We know that overweight children who are overweight become adults who are overweight, and then that follows them onward and sends a cascade of health problems. So we want to try to establish those habits earlier while we can. And we want to try to establish them encompassing everybody. So that's one thing that I have to hit home all the time, that, you have to come at this in a two-pronged approach, like how we're going to approach the child. Do they want to change? Do they want to make these steps? And how are we going to approach the family? So that means, if grandma and grandpa come home, they can't undermine something, in front of you, and they can't be the bad guy, they can't be the good cop and you're the bad cop. And if that's a discussion you need to have, then that's a discussion you need to have, because this has to be a team-based approach. Absolutely.
Yes, no, definitely. And I think I'm going to pull up just briefly, because we're almost at the end of our time, but there were a couple people who submitted questions. And I'm trying to see if we've addressed some of them while we're talking about it. So since we have talked about screen time just a little bit, a question was, what are your thoughts on screen time for teens, and how much is too much?
So it's funny that's mentioned. So I think the AAP is very clear about screen time for younger children. So 0 to 2, nothing except FaceTime. And parents are like, what? And but yeah, that's true. Nothing except FaceTime. And FaceTime only came into being 10 years ago.
Right.
Really nothing. And then as you get older, they try to limit it to 2 hours of entertainment time. And 2 hours is a long time.
Oh, wow.
It really is. Like, sit there and look at the clock from 2 to 4 p.m. That's a long time. So if that means you have to put restrictions on your media devices, then so be it. So for teenagers, that counts as well. It's 2 hours of entertainment time. What we're seeing is actually that more and more children, like the average 8 to 10-year-old school-age children, is using about their screens for about 8 hours a day. And that includes educational activities.
It's like a full-time job, 8 hours a day.
And teenagers, 12 hours a day. This includes educational activities. So I think it's hard because school is not using an overhead projector anymore. Everybody's getting their own little laptops or their tablets. You're going home and the homework is all on the internet. It's not in your textbooks. But if anybody has ever been a teen knows that if you're looking up something on Google, you are definitely also on Facebook, and you are also Snapchatting, and you are also doing this. And you're also texting your friend. So it's all mumble jumbled into one. And time management becomes hard. And so, yes, you're seeing teens on their screens up to 12 hours a day. So my thoughts on it are are, I'm probably gonna be unpopular here, but you gotta set limits if it's important to your family. So that's how I tell parents. It's important to me. I pick and choose what things I want to be on a soapbox about in my house. A pediatrician, I can't be everywhere at all times doing everything.
Right.
I childproof as much as I can. I try and run after her as much as I can. What I can't get to, I can't get to.
Right.
Screen time is important to me. I don't want my child to grow up seeing, a phone in her face, because that's not how I grew up. So if it's important to you, you got to take a stand. And there are options out there. So what I encourage families to do, if you're interested, is Google, the AAP Family Media Plan. And what it does is it's it's like a PDF document, and it sets aside, just kind of some of the things I said. So media-free zones in the house, how long we're going to be allowed to be on our screens, and we're going to set aside some rules, and everybody abides by them. That includes mom and dad.
Yeah.
So, role models. Already said that in regards to, what we eat, but you got to be a good role model too. So that means that when I come home, that doesn't mean I, just zone out in front of my phone. I signed up for parenthood. This is what we got to do as parents. You got to be engaged, because anybody who's had a teen knows that they're not going to abide by it if they see loopholes around it.
Right.
So we got to abide by it as much as we can. And so set a family media plan, set limits on restrictions on what your children can watch and see. You can do that. You can see, what's R-rated, what's blocked. When it comes to video games, etc., you can even play them with your child. Consider it a family activity, but that also keeps you engaged in what kind of content they're watching. Some of these video games can be pretty violent. And then also it keeps you monitoring how long you're playing. All right, 2 hours are up. We got to go do another activity, buddy. So get involved. If you want to play with them, go ahead and keep it a family activity. And then lastly, this one's hard, but keep the TV out of the room. And if you can, buy an old-fashioned alarm clock for your child and have them charge their phone somewhere else. We have all done that, where we plug in our phone and we're sitting there and we're just on our news feed or on, social media for 20 minutes, 30 minutes, 40 minutes. And that's crucial, great sleep that you can, that you're missing out on. So if you have to plug in your phone, it can be in your room, but set it about, 10 feet away or so from you. Yeah. Those are some of the rules that I try and tell parents to look at.
Yeah.
If it's an important thing to them, which in my house, it's important to me, those are some of the things that we try to do.
Yes. And I think that those are excellent tips, and especially, all of them are, but I know one that we've even started for ourselves just as adults was I went and dug out, like out of a box somewhere, our old-fashioned alarm clock to put up, because I would notice sometimes I would, like, if you wake up in the middle of the night to use the restroom or whatever, I would look at my phone and then just that light from the phone. And so then I would have trouble going back to sleep. And I'm like, okay, I need something that is just like away from, move the phone and just look at the clock. Like, if that's what I want to know, what time it is, like, I can look at an old-fashioned clock that's minimal lighting and doesn't really do anything. I can't check anything. I can't check my email when I grab my phone, or those type of things, because you're right. That messes up your sleep completely.
It messes up your sleep. And it also, think back to a time when you woke up and the first thing you didn't do was grab your email or check your email, and that anxiety that you wake up with.
Yes.
And God, don't you miss that?
Yeah.
And so once you try and make that commitment to yourself and your mental health, and then encourage that amongst your family, then it doesn't matter, about your child feeling left out if, they kind of have that ease of mind and they have that restful sleep when they go to school.
Mm-hmm. And no, I think those are all good tips. And then I'll just do one more question. Sorry, guys, we're about out of time, but TS with several ones, I'm not sure how many ones, and a Z, says, so we talked a little bit about this, but their question is how to cut out sugar completely for a teen who eats too much sugar every day for years, but is now considered to have, I guess, pre-diabetes. So, you know, again, I don't, we kind of touched on this before. You don't necessarily have to cut out sugar completely, but what are some ways that they could reduce sugar from their diet?
Sure. So, so exactly, you're right. First of all, that you don't have to cut out sugar completely. So, a lot of things get bad raps nowadays. You know, the buzzword is high fructose corn syrup, but you know, sugar is in many things. Sugar's in tomatoes, sugar's in apples, sugars are in bananas, sugars are in sweet potatoes, all of these really good fruits and vegetables that are out there. I think the key to understanding the piece of this puzzle is though that those are free sugars are naturally occurring and our body metabolizes them in a different way, which, you know, I'm sure you know much more about, but it curbs our energy intake in a better way. So you're not hitting these high peaks and these low lows that everybody's so worried about when they eat their sugar. So that's one thing. The second thing is, so you don't cut it out completely. You would drive yourself crazy doing that.
Right.
And cause serious metabolic concerns and health concerns if you did that. So ways to decrease it. First easiest way to do is look at what you're drinking. So this is the simplest thing ever. Just switch to water. Just switch to pure water because that has no sugar in it.
And notice we did not say switch regular pop to diet. No. You know, we didn't say replace your diet pop with juice. Right. No. It's water, because the sugar sweetened beverages, the artificially sweetened beverages, the ones that say, look at this smoothie, it's healthy, you know, like not to dog Monster, but like the Monster smoothies. Look at the back of that and see how much sugar is in it. You know, if you're drinking a lot of stuff during the day, replacing it with water goes like so far. I mean,
I know.
Huge.
I mean, you know, just a patient in my clinic alone, he drank a 12-pack himself of sodas a week.
Oh, wow.
And so there's 7 days in a week, and he drank 12 sodas in a week.
Yeah.
So cutting that out alone is massive. So the sugar is twofold. So, you know, you take a sip of a sugary drink, and for 20 minutes, you're in the cavity zone. So then you take another sip 20 minutes later, you're in another 20 minutes of a cavity. You know, so that's how it causes this health cascade, you know, increased cavities, increased fat, because we're not moving while we're taking this sip of sugary drink. So one thing alone, simplest thing is to try and look at what you're drinking and cut it out from there. You know, I have a lot of people who tell me, well, but you know, it's baby juice. Well, that's not a real thing.
No.
That's not a thing.
Yes.
That's not a thing.
No.
That's not a thing. If you swear up and down to me that, you know, your child must have juice, then I tell parents 5 ounces maximum, and dilute it with water, you know, if you need to. But just like I said, the cavity zone thing. So, you know, you don't want to have them sipping that sugary drink all day long. If you want to give them the 5 ounces in the morning and then the rest of the day give them water, that's fine. Slowly decrease the amount of juice though, because you're just starting, you're starting unhealthy habits to begin with. You know, by no means is juice healthy. Right. Just eat the fruit. I always tell people, you'll burn more calories while you burn it.
Yeah.
So
less of it, because you're not going to eat 10 apples in a day, but in apple juice in an 8-ounce cup, I mean, tons of apples without, like you said, any of the fiber or the other nutrients that help avoid the peak and valleys and the
and you know, and just like you said, it's a sugary drink. So milk has some sugar in it. Milk has a natural sugar in it called lactose. You don't need to chase the milk around that has the lowest amount of sugar, or, you know, the highest amount of, you know, fat or the lowest amount of carbs. Just try and eat food in the most natural form that you can, and you're going to do great.
Yes. And so I think that would be the key to start with anyone, whether they have a health condition or not. When you reach for whole foods, I mean, nature had it worked out, and we've kind of messed it up a little bit. But nature kind of already had the calculations done for us, so we didn't have to think about it. So if we just go back to the premise of trying to eat fewer things out of a package and eating fewer things that didn't exist 100 years ago. I mean, I'm just going to bet that people weren't drinking monster smoothies 100 years ago.
No, and
Go
even
out on a
smoothies
limb.
like acai bowls and everything, tons of sugar. Well, you could just ask, like, can I have mine with unsweetened yogurt? Can I have mine without juice? So just look and make conscious decisions about where those hidden sugars are hidden.
Yep.
And you'll be fine.
Yes. So, well, no, thank you so much. And then also, where do you have a website?
Yes. So I have a website. If patients or if anybody's has any questions, they can actually message or direct message me on Instagram. It's at dr.amna Hussain, AMNAHUSAIN. I can actually just type it in right now. They can message me directly there. Also, they can email me at, and these are just great ways to just kind of get in touch with me directly if anybody really has, any questions. But they can also email me at drhussain@puredirectpediatrics.com. So I'll just type that in too, if it's helpful for anybody. But yeah, I'm happy to answer any questions anybody has. Usually, I always tell parents that I don't mind any questions. I actually prefer helicopter parents to the to the not caring, negligent parents. So usually parents have really great questions, and they're very concerned, and the concern comes from a good place. And as a pediatrician, you can't really get annoyed by that.
Right, because you'd rather, I mean, yes, sometimes people are like, oh, maybe I have too many questions. But the thing is, I mean, we're here to assist with health. And so I'm going to go out on a limb and say that's why most physicians went into medicine.
Right.
And so you definitely should address questions, concerns with your physician. And even if they don't have time to address every question in that visit, they may be able to get through some, and then, you guys schedule a visit or follow up or whatever.
Exactly.
And
that's why we do, 10 visits, so that questions that come up along the way, we're able to address them.
Yes. So no, definitely. Well, thank you so much for your time tonight. This was great. And the replay will be up in the stories for 24 hours. And then my husband is clever. He found an app that will actually record this, so that we can have a replay of this too, so it doesn't just disappear. So
that's great.
I'll
That'd be
share
perfect.
that with
I'll
you too.
Tag that over on my site too. That's awesome. That's wonderful. Thank you.
Right. Well, have a good night. Thanks, everyone.
You too. Thank you. Great speaking with you. Bye.
As well. Thank you.